Canadian singer Céline Dion has canceled a string of upcoming concerts because of health issues. She says she has a rare neurological disorder called stiff person syndrome.
I've been dealing with problems with my health for a long time. And it's been really difficult for me to face these challenges and to talk about everything that I've been going through. It hurts me to tell you today. This means I won't be ready to restart my tour in Europe in February.
Dion apologized on social media to her fans for the cancellations. She said the disorder gives her muscle spasms that make it difficult for her to walk at times. She says they also affect her vocal cords. She said she's being treated for the condition and hopes to recover and reschedule the concerts. Let's stay on this story right now. I want to welcome Dr. Chris Hahn. He's a clinical associate professor of neurology at the University of Calgary Cumming School of Medicine. Dr. Hahn, welcome to the program.
Thanks, Hannah. Happy to be on.
Thank you. This is a very, I've never heard of it. So what do we know about stiff person syndrome?
Well, you're not alone. It's a very rare condition. It's about 1 to 2 people in a million will have this condition. And it's an autoimmune disease, meaning our own infection-fighting cells are actually attacking our body and causing damage. In this case, they're causing hyperactivity in the central nervous system.
So what type of indication might Céline Dion have had originally? Because this could go back as far as 7 years, we're hearing.
Yeah, and it's a very challenging diagnosis to make because many of the symptoms like stiffness and spasms are very common in our society, based on our maybe more sedentary lifestyles than we should have. Not uncommon for anybody to have cramps or stiffness or spasms over a period of time. So this diagnosis is often missed for quite a while. But once the symptoms really become severe, people have trouble walking, people have trouble sometimes speaking, swallowing. And at that point, it becomes more obvious, but sometimes this is still attributed just to kind of wear and tear or spinal problems or other kind of muscle or nerve problems.
It almost sounds, it has some types of symptoms like a Parkinson's.
Yes, and so that can be part of the challenge as well, because stiffness is one of the core features of Parkinson's disease as well. And it takes somebody who has training, neurologic training, or rehabilitation training often to recognize the difference between the kinds of stiffness and potentially clue you in that this person has stiff person syndrome rather than Parkinson's disease or another related disease.
Now, is there any cure for this?
Well, it's typically a chronic condition like many autoimmune diseases. And the cornerstones of therapy are a little bit different than some other autoimmune diseases. Immunosuppression, meaning suppressing those infection-fighting cells, is still an important part of treatment. But often we start with muscle relaxants. In some patients, that's all they require. So drugs like benzodiazepines, which are commonly used as muscle relaxants or anti-anxiety medications, are one of the cornerstones of the treatment.
Will it continually get worse, progressively get worse? Is it a progressive type of disease?
It typically is. And so often, if the muscle relaxants don't work, then we try different medications that actually suppress the immune system. And in some patients, even despite that, the symptoms can get worse and worse over time and cause more and more disability over time.
What type of research is being done into this?
So I'd like to be optimistic here and tell you there's lots of research, but like many rare neurologic diseases, there's really not very much research going on. And part of the problem is when you're dealing with a condition that happens to 1 or 2 in a million people, it's hard to have a lot of people to be part of a research trial and also hard to find funding for it. There are some ongoing research studies in the US looking at some forms of immunosuppression for the disease. But it's definitely less than we need, and especially given some of the severity of the disability that this disease can cause.
Yeah, one of the things clearly for Ms. Dion is her vocal cords, and that's something that she says are being affected as well. Is there anything that, what happens there, and is there anything that can be done to alleviate that?
Yeah, so our vocal cords are muscles like other muscles in our body. And so just like other parts of the body get stiff and sometimes spasm in this disease, so can the vocal cords. And when the vocal cords spasm, you can imagine that alters our voice, alters our ability to sing. And so there aren't specific therapies, at least that I'm aware of, for the vocal cord part of this problem. Sometimes they can do Botox injections directly into the vocal cords. I'm not sure if this has actually been tried in stiff person syndrome. So we would typically use our muscle relaxants, which have more of a effect over the whole body, to try to improve that, and then use some of these immune suppressing medications as well.
And looking ahead to Ms. Dion, is there anything you can see possibly happening down the road for her? Do you think she'll be able to do her concerts again?
I'm hopeful. We definitely have some people who do very well with this disease with our therapies, and I'm really hopeful. I mean, Céline Dion is a Canadian treasure, right? So I'm really hopeful that she gets better and can return to her singing career.
Yeah, absolutely. Dr. Chris Hahn, thank you for helping us understand this disease. It's something most of us haven't heard of before.
You're very welcome.
Okay, Dr. Chris Hahn of the University of Calgary's Cumming School of Medicine.